If you're like me or one of the many allergy sufferers who going outside this time of year is a little bit difficult, and joining us this morning to clear things up a little bit from Gunderson Health System, Dr. Jared Darveaux. Dr. Darveaux, thanks for joining us this morning. First, I want to talk about it. Pollen is what we always hear about with contributing to allergies, but I guess how exactly does pollen affect us to cause these reactions?
Pollen and molds and other allergens, it depends on the way that they're exposed to the body. And when you inhale an allergen, your immune system recognizes that, and it sparks an allergic reaction, and that's what triggers all your symptoms.
Yeah, symptoms like sneezing, coughing, runny eyes. I mean, what can we do to prevent that? Should we be taking medicines before we even see those symptoms?
Well, that's part of it. Probably the biggest thing with allergies is avoidance, and it can be real tempting when we get to these warmer weathers to open up all the windows in the house and let some fresh air in. But when those pollens are at high counts, that really can set you up for disaster. Yes, many of the medications are used. They work better if they're used preventively. So if you are a springtime allergy sufferer, starting those now would be a good idea.
Now, with some of those preventative medications, are there risks to taking them? Are there things you should watch out for before you maybe take that little allergy tablet?
Well, allergy tablets in general are fairly benign. Most of them have a potential side effect of a little bit of drowsiness and dry mouth. Those are probably the most common side effects, but they're over-the-counter medications that are fairly safe.
Good to know.
As far as the intranasal nasal sprays are concerned, the side effects with those can be headache and maybe nosebleeds if they're not administered properly. And so talking to your doctor or pharmacist about how to properly direct those would help with that as well.
And you mentioned when the allergies seem to be worse, sometimes people are having more reaction. Does that change for people? Sometimes it's right when the pollen hits, or sometimes rain can affect it too?
Well, certainly. We had a little bit of a jump start on the allergy season here with the warm weather earlier this spring, and then when we had this big snow over the last weekend, that sure dropped the pollen counts down. We always think about tree pollen in the springtime, but molds can actually be a problem for people in the springtime also. Mold typically rises through the spring, summer, and fall months. And the snow settles it down over the winter, but then when people first fire up their lawnmowers in the spring, that can kick all of that into the air and cause problems again for people too.
Always just a great time of year. Dr. Darveaux, thanks for joining us this morning to shed some light on the spring allergies.